Assalamu alaikum. The idea I would like to spread today is about thinking big and thinking system level change. I hope that the journey of Child Life Foundation will inspire some ideas to the audience here. So, what's the big idea that Child Life thought about? Let's save every child. We are not talking about running one clinic or one hospital or 100 children, but children across Pakistan. And how do you want to save every child? No child is more than 30 minutes away from world-class health facility, which runs 24/7 and it is totally free of charge. So let's hear in 50 seconds what that message is.
नोश की भक्ता वाला
तंगवानी करक जुड्डो दुखी पिपला बाग जो कंडियारो गोजरा बारखान।
जिन नामों को आपने पाकिस्तान के नक्शे पर भी नहीं देखा, वहाँ भी चाइल्ड लाइफ फाउंडेशन आपकी मदद से अपने इमरजेंसी रूम्स और टेलीमेडिसिन सैटेलाइट सेंटर्स के जरिए लाखों बच्चों की जिंदगियां बचा रहा है, ताकि हर बच्चा 30 मिनट के अंदर मुफ्त और मयारी इलाज की पहुंच में हो।
Alhamdulillah, today 90% of Pakistani children, 90% of Pakistani children are within 30 minutes of a government facility which provides 24/7 quality emergency care free of charge. Now, if this is where we have achieved in 15 years, it did not start that way. So the first starting point was this beautiful emergency room. You know how far this is located from this place? Less than 2 miles. This is the children emergency room of Civil Hospital Karachi at Dow Medical College. यहाँ से 2 kilometer दूर है ये. And the residents would not call it hospital, they would call it astabal. No wonder Pakistan's mortality is that high. But this is not alone Karachi. This is the children emergency room of Larkana. And this is Multan. So across Pakistan, गरीबों का अस्पताल बहुत गरीब है. Stanford did a study 12 years ago that 12% of children coming to emergency rooms would die. 12% बच्चे emergency room में जो आ रहे थे वो मर जाएंगे. What's the impact of child life? First step, this is now the children emergency room at Civil Hospital. ये वही सिविल अस्पताल है, and now this is a world-class emergency room. This is Larkana, and if you remember the previous picture, this is a 100-bed children emergency room in Multan, 24/7, free of cost, world-class quality. But don't take my word for world-class. 29th of January this year, Lancet published a paper about children emergency rooms across 19 countries. Pakistan was one of those 19. And Lancet says that the emergency rooms where Child Life is working, Civil Hospital and Larkana and others, the mortality rate is now 1.2%. So 12 years ago, the mortality was 12%, and the mortality now is 1.2%, 10 times reduction. That's one impact. The second impact is even more important. The third hospital in this study from Pakistan was the best private hospital in Pakistan. And its mortality was at par at 1.4%, which means that now in these government hospitals, we are able to provide same level of quality which is available at the best private hospitals in Pakistan. But the difference is, private hospitals would treat 20,000 children a year in ER with charge, and Child Life government ERs would be 20 lakh children every year and free of charge. But this was the major cities where you have tertiary care hospitals. But Pakistani government hospitals are still overwhelmed, overloaded. Hospitals are supposed to run at about 85 to 90% capacity. Child Life emergency rooms are running at peak loads of 402%. यानी अगर 100 बेड हैं तो 402 मरीज एक वक्त में मौजूद हैं. And quality is inversely proportional to volume, which means you need to expand. And let's not forget that 2/3 of Pakistanis live outside main cities. So if you're living in Thatta or Khanewal or Badin or Washuk or Batkhela, what are you told? तुम्हारा बच्चा मर जाएगा, इसको कराची ले जाओ या इसको लाहौर ले जाओ. So we established through technology and innovation and spread it across Pakistan, and that was the thinking big part. And what was that innovation? Establish a telemedicine setup in each of the government hospitals where there's a nurse on Child Life payroll at the site, working with a government doctor, and at the other end, we had a control room where you have pediatric specialists working 24/7, and they would provide advice after looking at the child through camera and using a phone. And the impact is that in 46% of these consultations, there was a change in treatment. A child was being treated with pneumonia, it was actually lobar pneumonia. Child was treated for viral fever, while meningitis had to be ruled out. This is life-saving. How does this work? I'll give you a 50-second clip to get you an idea, so that you get an idea about Pashin. Pashin is a place 45 minutes north of Quetta. What you will see is a district hospital Pashin, a male nurse getting consultation on a dog bite case. Please remember that rabies is fatal. अगर rabies हो जाए तो बड़े तड़प के मौत होती है. The only solution is preventive. Within 72 hours of the dog bite, you have to treat it right, and you have to categorize. It's the category 1, 2, or 3 bites, so the treatment is accordingly different. Let's see how that happens in Pakistan now.
Good morning, doctor. This is staff nurse Hidayat calling from district Pashin.
Good morning, Hidayat. This is Dr. Saira from Telemedicine Control Room.
I want to discuss a patient with you. Patient's name is Imran. He has been bitten by a dog.
Where he has been bitten?
There are 2 bite marks on his right leg and the wounds are bleeding.
I can also see there is a bit of swelling. We can now categorize the wound as grade 3 of dog bite. Firstly, please wash it with soap water for about 15 minutes and then administer first rabies vaccine on his right arm 0.5 ml intramuscularly. Then please give rabies immunoglobulin as well. Please enter the patient's detail in mobile nursing application. I will also enter medicine details in the app and inform the emergency room team in Quetta about the patient's arrival.
And this is my last slide. Look at the map of Pakistan. Today, when I say 90% of children are within 30 minutes of free world-class treatment 24/7, look at this map. How many tehsils are there in Sindh outside Karachi? 105. And we are operating in those 105 hospitals in Sindh. How many districts in Balochistan? 33, present in all of them. 159 district and tehsil hospitals in Punjab, present in all of them. 24/7 across Pakistan in 300 plus hospitals, providing and saving children. That's the idea. I hope you can take this message and apply it to your own program. Think big, and inshallah, you'll be able to do a system level change. Thank you so much.